Well, Project Lazarus, I think, is a relatively flexible intervention. I mean, at its core, it's about community mobilization. So community mobilization can be any topic. A lot of emphasis is really focused on the prescription drug part of this epidemic, but there are kind of a co-mingling or intertwined epidemic of increase in heroin use. And again, evidence is increasingly showing kind of two schools of thought, that some heroin users start with heroin, switch to prescription drugs, and then move back to heroin. There's another school of thought that people start with prescription drugs and then move to heroin. It's unclear how people are kind of flowing back and forth between some of these things, but at the core of it, it's an opioid addiction, and both of those things have opioids relative to it. And Project Lazarus, as a community intervention, again, has kind of a wide berth in terms of how it can intervene and how it can address some of those issues. There might be parts of it that with prescribers and dispensers that are less relevant if the issues are heroin specific. But again, some of the interventions in terms of making sure people have naloxone kits, and making sure people are co-prescribed and getting naloxone. Naloxone is going to save someone whether it's a heroin overdose or a prescription drug overdose. So making sure counties and jurisdictions have access to naloxone. So local health departments, making sure EMS is trained first responders, so when police or other folks arrive first on the scene, that if it's an overdose, that people can respond to it. So, I think depending on the part of Project Lazarus you're referring to, it has a lot of potential to address kind of a wide range of issues. It's a pretty comprehensive program. I'm sure, as Kay and others will describe, it's got a kind of a hub and spoke, and each one of those spokes has different pieces of it that can affect lots of parts of this problem.